Hey, Dr. Buzza.
Hey, Tom.
I got a question for you.
Okay.
Tell me about sedation dentistry.
Sedation Dentistry? The fact that maybe we are the best in the North Bay?
Why?
Well, you know, we brought it here. We were the first ones in Northern California to do it. And we started doing it like 14 years ago. And people have just found that it's the most incredible service. Matter of fact, there's a lot of dentists in town that have patients that really, they believe, need the help that we can offer them, and they send their patients over to us as well. We take a little blue pill about an hour before you come, have somebody, your spouse or your significant other, drive you over, a friend, and we put you in a nice, comfortable chair, and it's really cool. Put on an iPod with some really cool music, and you know those little things you put over your eyes, like when you're on an airliner, so you can sleep and get rid of the light, and we let them go to sleep. Just let them just lounge in the chair for about half hour to an hour, and they'll just snooze. And once they're sound asleep comfortably, then we go in and get going, get all the work done. We can usually get a full mouth worth of work, something that would take 7 or 8 appointments. We can get all the heavy lifting done in one day. Yeah, amazing. And then they come back in about 3 weeks, and whatever permanent restorations need to be cemented, we put them on that. You know, traditional dentistry with a patient awake, even me, when I'm awake and I'm being a patient, I'm still tense and kind of wondering, you know, is it going to hurt? You just never know. And so when a patient's asleep, it's amazing. They don't shoot the cortisols and all the bad types of all the bad things that you can. The hormones, cortisols, all those kinds of things which cause inflammation, post-operative pain. You just don't get that. So it's really fascinating that patients the next day, we've got literally hundreds of surveys that patients have taken, time after time. The next day they come in and say, I feel great. The next day, they say, I hardly even know I was there or had anything done.
Is it more expensive?
To do the dentistry?
Sedation, yeah.
Absolutely not. Matter of fact, there's a small fee for the sedation part of it, because one of the things that we're really careful about is monitoring our patients just as we would in a hospital. We put a monitor on them so that we're monitoring all their vital signs, and we have specially trained assistants who are there chairside 100% of the time, making sure that they're well cared for. And never, ever once have we had an episode. We're so ultra careful that our patients come in, and with confidence, they get the work done. Next day they come in feeling great.